Good morning everyone, myself Dr. Anusha from the Department of Pontics. Today I am going to present on Pontics. So basically what is a Pontic? Whenever there is loss of teeth, we have to replace the teeth either by removable process or by fixed processes. Removable process, if you are giving, we call it as removable partial denture. In fixed process we have two options. One option is implant, the other option is fixed dental process. This is fixed dental process. Whenever there is loss of teeth, what we are going to do is we have to prepare the abutment teeth. Means with the same contours we are reducing the size of the teeth. This is called teeth preparation, and this is your abutment teeth. And on top of that you will get fixed dental process. This is fixed dental process. It will be having a retainer, Pontic, and this is called abutment, and this is your edentulous ridge. So we are going to discuss about Pontic and different types of Pontics. So what are the functions of Pontics? So whenever there is loss of teeth, what happens is your function will be restricted and your aesthetics will be like you will be having less aesthetics. So in order to regain that function, we will be giving Pontics in that edentulous site. Okay. And whenever there is loss of posterior teeth, your mastication will be hampered. So we will be replacing the teeth to improve the mastication. And speech. If there is loss of anterior teeth, your speech will be affected. So by replacing that teeth, your speech will be regained. And maintenance of relationship of adjacent teeth. So here basically whenever there is a missing teeth, what happens is the adjacent teeth will tend to tilt into that position and opposing teeth will tend to supra-erupt into that position. So we have to replace that teeth either with removable or fixed processes in order to avoid this pathological migration of the teeth. And aesthetics. So for any process in prosthodontics, there will be three considerations. They are called biological considerations, mechanical considerations, and aesthetical consideration. So in Pontics, biological consideration include cleansable tissue surface. The Pontic will be having a gingival surface which should be maintained easily by the patient, means it should be having self-cleansing property. The next thing is access to the abutment teeth and no pressure on the ridge. The Pontic should not impinge on the gingival tissue. What happens if the Pontic impinges on the gingival tissue? There will be ulceration of the tissue and subsequently there will be subpontic hyperplasia. So the second thing is mechanical considerations. Mechanical considerations, it should be rigid, means the Pontic will be having connector with the adjacent abutment teeth. It should be rigid such that it should resist the deformation of the Pontic. The second thing is strong connectors. The connector should have sufficient width and height. Minimum 3 into 3 mm height should be there, so that during our occlusal load, it should withstand that load. So it should be strong. The next thing is metal ceramic framework. So when compared to zirconia, it is preferred to give metal ceramic framework in the posterior region because of high strength. And aesthetic considerations. So aesthetic considerations, the teeth we are replacing, it should be identical to the teeth which has been lost, and it should be appear such that it is coming out of the ridge, like natural emergence profile should be there for that Pontic, and there should be sufficient porcelain for the teeth that has been replaced. Okay, this is the Sibbert's classification. This is basically classification of the edentulous ridge. Okay, here this is class 1 where there will be horizontal loss of the tissue. This is class 2 where there will be vertical loss of the tissue. This is class 3 where there will be both horizontal and vertical loss of the tissues. Okay. Biological considerations, as I discussed you earlier, in the biological consideration we have to take care of ridge contact, oral hygiene, Pontic material. Rich contact means it should not contact the rich. And oral hygiene, patient should be able to maintain his oral hygiene. And Pontic material, generally ceramics or glazed porcelain is the best material for Pontic, because it will the polish of the surface will not allow any bacteria to adhere to that surface. And occlusal forces, occlusal forces should be minimal, because whatever the forces the Pontic is taken, it will be distributed to the abutment teeth. So we will reduce the buccolingual width of the Pontic such that there will be less occlusal forces transmitted to the abutment teeth. Next, ridge contact. See this picture. If you are giving full contact with the ridge, there will be hyperplasia of the tissues and ulceration of the tissue. Patient should be easily means our Pontic should be self-cleansable such that patient easily cleans that surface. Okay. This is a picture. Short span Pontics will be having will be distributing less forces to the abutment teeth when compared to long span FPDs. We should see that the buccolingual width will be reduced and less force is transmitted to the abutment teeth. Mechanical considerations, choice of the material, metal ceramic material is the best for this Pontic. And amount of tooth preparation, there should be sufficient amount of tooth structure, and there also be sufficient clearance for the material in order to reform it from fracture. And poor occlusion, poor design of the framework will also affect the mechanical properties. Aesthetic considerations, here we should see that the buccal surface of the Pontic will be contacting the buccal surface of the ridge for aesthetic purposes. And here the teeth which we are replacing and the teeth which are lost, it should be of same buccolingual width. And say similarly in the posterior region, for the Pontic we will reduce the width. Classification of the Pontic, depending on the shape of the Pontic contacting the tissue, there will be with the mucosal contact and without mucosal contact. And depending on the material, all ceramic, metal ceramic, all metal Pontics. And depending upon the method of fabrication, prefabricated Pontics and customized Pontics. And according to the mucosal contacts, with mucosal contact and without mucosal contact. These are the different Pontics. I will be discussing it in further slides. Method of fabrication. These are called prefabricated Pontics. These Pontics are readily available so that we can use directly them. This is first thing is true Pontic. As we can see, this type of Pontics will be having facing and backing. Here we will be discussing about facings. In this true Pontic, there will be horizontal slot. This horizontal slot runs from buccal to the mesial direction, and backing will be having elevation that fits into this facing. Okay, and this is sanitary Pontic. This sanitary Pontic, there will be having proximal depression. Here it is horizontal, here it is from mesial to distal side. There will be having depression into this, backing will be having elevation that fits into this depression. And pin facing, here the retention is mainly by these two pins. Okay, these are two vertical projections or pins that comes with this facing, and counter backing there will be two holes. These pins fits into that backing. This is reverse pin facing, same here there will be more holes. And this is interchangeable facing. In this interchangeable facing, here there is horizontal slot, here there will be vertical slot. Only that is the difference between these two Pontics. These are all prefabricated and readily available Pontics. And according to the mucosal contact, these are the different Pontics. These are the different materials which we use for Pontics. Metal ceramics. Metal ceramics will be having more aesthetics and they are more biocompatible when compared to all ceramic, when compared to all metal Pontics. All metal Pontics, they will be having more strength and it is easy to fabricate all metal Pontics, because we will be doing wax pattern only and directly we are putting it for casting. But whereas in metal ceramic Pontics, we have to do cutback technique and we we have to prepare the metal framework. On top of that, we should do ceramic buildup and other types of fiber reinforced and facings are which you have seen earlier. Okay, these are the different types of Pontics. The first thing is saddle Pontic or ridge lap Pontic. Saddle Pontic is nothing but, as you have seen saddle on the horse, it is like the shape of a saddle which will be having contact on the buccal and lingual surface, and in the middle there is no contact. Initially this Pontic was given, they thought that it is aesthetic and easy to cleanse, but later on what happens is there is food accumulation happening in this Pontic. So what they have thought is that they want to change the design of the Pontic from saddle Pontic to modified ridge lap Pontic. This is saddle or ridge lap Pontic. In modified ridge lap Pontic, what they have done is they have removed this lingual part, okay, and they have created only contact on the buccal surface. This contact is called T-shaped contact. As you can see here, it is a T-shaped contact. The vertical part runs on the crest of the ridge, and the horizontal part will make contact on the buccal surfaces. Okay, this is called modified ridge lap Pontic. Here the contact will be there only on the buccal surface. This Pontic is generally given in maxillary posterior teeth, where aesthetics is of high concern. Next Pontic is ovate Pontic. Ovate Pontic is generally given where in cases of ridge defects and in cases of immediate extraction. This Pontic is given. So eventually the socket will heal. We have to remove this Pontic and trim the Pontic eventually until full healing happens. Okay, this is ovate Pontic. And the other thing is conical Pontic. In conical Pontic there will be only one point of contact with the ridge. This Pontic is generally given in maxillary posterior teeth region, because here aesthetics will be hampered due to wide embrasure spaces. We will give it in only mandibular posterior region, where cleaning is more important. The next type is hygienic Pontic. Hygienic Pontic, it is also called as fish belly Pontic, because can you see this shape? It is in the shape of fish belly. Here both the buccolingual and mesodistal surfaces will be in convex shape. But the major disadvantage of this design is there will be less connector width and height. So there will be fracture of the Pontic near the connector. So in order to overcome this, they have modified this hygienic Pontic. They have modified this hygienic Pontic. This is called modified hygienic Pontic, where they have turned this design to hyperparaboloid shape, so that here the connector thickness and width will be increasing. These are the different types of Pontics. This is modified. This is published by Gnani. This is same ovate Pontic, but here the tissue contact is moved more to the buccal surface. This is called Andrews bridge, where we will be giving in class 3 defect Sibbert's classification, where we will be having both horizontal and vertical defect. It is both removable and fixed process. We will be preparing the abutment teeth, and there will be a rod in between. On top of that, we will be giving a removable process. This is the immediate fixed temporization, where the extracted teeth is used as a temporary material. Same teeth extracted, that is placed on the edentulous site immediately after extraction. This is also same case, where 2 teeth were used and they were fixed to the other teeth with fiber reinforced technique. And conclusion, design of the Pontic is probably the most important factor in determining the success of restoring the patient. Minimizing the tissue contact by maximizing the convexity of the Pontic gingival surface is essential. Thank you.